Diabetes is a big one. I had a guy the other day who was a diabetic, young guy, and he's in his 30s, and he's already got diabetes. He's overweight. And I said, oh, well, you going to go get your blood work today? And he said, well, you need me fasting, right? I said, yeah, you can't. Did you eat anything for breakfast? Oh, I didn't eat anything, but I had a coffee. I'm like, oh, you just had coffee? Oh, you're fine. It's been a few hours since you had. Well, it was a Starbucks. I said, what kind of Starbucks? Oh, one of those like venti frappuccino thing. I said, that's not coffee, that's a milkshake. So basically they don't understand a lot of cases. They're not educated on what's healthy and what's not, and what kind of things they should be eating and what kind of things they should be avoiding. So as a primary care doctor, as internal medicine, I try to educate them, and I think I do a pretty good job of kind of speaking in a language that they can understand. I do take a lot of time with my patients, and so for the patients that are scheduled later in the morning, I'm usually running late, and so I apologize for running late. I said, but you kind of get what you pay for. I like to sit and talk to my patients because I like to educate them, and we're not sitting there talking about the Saints and the Pelicans. I mean, we are in some cases if people are if everything's good to go, but most of the time we're talking about their disease states and what they can do to make things better. And in most cases it's just eat right, take your medicines, monitor things that need to be monitored, and come back for your regular routine visits. So